Hi everyone, welcome back. I hope that you're freshen up. So, as a pleasure, I'm going to invite one of the prominent professors of Tehran University of Medical Sciences. It's a great pleasure to have him with us. I would like to invite Dr. Abbas Ostatagizadeh, who is an associate professor in Disaster and Emergency Health Department, School of Public Health, Tehran University of Medical Sciences, Iran. And he's going to cover two very important topics that I'm gonna read. If Dr. Tagizadeh is available, I would really appreciate him to co-host, to change to co-host. Have you changed that? So now the system permits you.
Hello, can you hear me?
Share for sure. You're
Okay,
very
thank you.
welcome. I would be really appreciate if you could turn on your camera.
Yeah, I'm trying to present my slides. I'm not sure you can see it or not.
Not right now. That's okay right now. So, I'm going to read your topic, and that's addressing the needs of women and girls in disasters and emergencies with a focus on Afghan women. So,
Okay, unfortunately, I can't turn on my video, but for conserving the time, let me start. Okay, can
sure,
you see my
thanks.
slide?
Of
Okay,
course.
in the name of God, yeah. Thank you so much. Thank you, all of the participants. And it's my honor that I'm here and can share my recent researches that conducted in Tehran University of Medical Sciences concerning climate change. That is so important for planetary health. Let me start with the second issue, that is climate adaptation. That's so important. If we have time, we can change to the refugee health. That is one of the main topic and hot topics in the world. My name is Abbas Tatazadeh, as you said, and you mentioned I'm associate professor, head of the disaster and emergency health department in School of Public Health, as well as I'm head of the Climate Change and Health Research Center in Tehran University of Medical Sciences. This slide show that what's the problem. As you see, we are facing in the increasing of the temperature as the source and the main source and trigger of the climate change. You can see in this slide that the average temperature in the world, in all of the world, is increasing during the past decade, from the starting from the 1850, and gradually is increasing. And this is the trigger of the climate change and this main issue. Let me explain very briefly concerning the process of climate change occurrence. As all of us know that the main challenge that we are facing in the recent decade is the increasing of greenhouses concentration and emission in the atmosphere. And then when this elements such as CO2 and methane and NO2 is increasing in the atmosphere, we are facing a phenomena entitled global warming. And then we have changing in the temperature, we are changing in the precipitations and the speed of wind. All of this, this phenomena named climate change, and the climate change have different impacts, such as economic impact, agricultural impact, and environmental impacts, as well as health impact. That this is the our discussion issue in this presentation. We know that the health impacts are very, very vasted. When we are talking about the climate change, we are talking the climate change as a phenomena and impact of climate change, such as drought, flood, bushfire, or wildfire, increasing the level of seas, dust storm, heat storm, and extreme weather such as cold wave, um, um, heat wave, and etc. etc. It's so important that all of the people are not equally vulnerable to climate change. We have elder people, disabled people, children, women are more vulnerable to this issue. And the climate change can, influence different domain of our health, including physical health, mental health, and community health. Let me explain a very rapid, view concerning the climate change as main threat of health. When we have extreme climate change can disrupt different diseases in the community. For example, increasing in ambient temperature, increasing frequency and intensity of heat waves, as well as increasing the frequency and intensity of dust storm, increasing the water and foodborne disease, communicable diseases, non-communicable diseases, and increasing in vector-borne diseases. I'm sure that all of this issue is reviewed during two-day conference, but this is so important that we should, aware concerning the different, aspect of climate change, such as heat wave in our country and dust storm. That is common. When we are talking about the heat waves, our studies that is published in the BMC public health show that the heat waves can increase the risk of cardiovascular, renal diseases, and respiratory diseases, as well as the risk of hospitalization due to renal failure, cardiovascular failure, and respiratory, and as well as gastrointestinal diseases will increase when we are facing in with heat wave. There are different other, diseases such as nutritional diseases and risk of physiological problems such as cognitive problem in children, especially specifically, and risk of suicides can increase, risk of job-related injuries, and the number of emergency medical, services mission will be increased. This is so important that in the recent decade we are facing different, sand and dust storms in the Middle East. For example, as you see, we have in Tehran, in Dubai, in Doha, in Riyadh, in Baghdad, and other mega cities in the Middle East. This slide can show the sand and dust storm origins. As you see, the main origin of sand and dust storm is in the east of the west of the North America and South America, and mainly in the north of Africa and the Middle East. This is so important that is a significant relationship with the source of the dust storms and other allergic diseases and autoimmune diseases such as asthma. And you can see that the relationship between these diseases and the source of dust storm. In this slide, I can emphasize, and I want to emphasize that the Middle East dust sources in our country Most of them come from the borders, and some of them are the source of originally from Iran. Anyway, our study showed that dust storm can increase the mortality due to respiratory diseases, cardiovascular diseases, and other diseases. This part of my lectures, I think, give all of you an imagine that the climate change is so important for health. But what can we do? In general, all of the documents at the global level suggest two main strategy for combating with climate change. The first is mitigation. Mitigation means when we can reduce the reduce the emission gases that are in the atmosphere. As climate change in gradually become more and more, when we decrease the level of the CO2 in the atmosphere, the impacts will show and will be significant in the next decade. The question is that what can we do right now? The main actions that we are expecting conducted in the community, in the cities, in the national level, in the healthcare level, and in the hospital is adaptations. And I want to focus on the different strategies and different action plan that can we do for adapting to climate change. The first study that we conducted in the School of Public Health, Tehran University of Medical Science, shows that when we are talking about the climate change have different domains. As you see, climate change adaptation have different domains, such as natural domain, social domain, cultural domain, physical, economical, and governmental domain, and institutional domain. This is so important that our studies shows that when we are talking about the climate change adaptations, the weight of institutional domain is so prominent. It means the first step for climate change adaptation at the national level, at the local level, and the other levels, it's to changing the mind of managers and policymakers and decision makers. That is so important. I'm just not focused on the detail of this slide, but you can study the main article if you are interested. But this is so important that when we want to change our we want to conduct some strategies and action plan concerning adaptation, we need to focus, we need to consider all of the aspects, all of the domain of climate change. The second study that I want to present to you, this is the climate change adaptation strategies in Iran that we conducted in 2022-21, sorry. And we noticed that when we are talking about the climate change at the national level, there are 5 main strategies that I wanted to explain more about this strategy. The first is education. The education is so important as you mentioned during these 2 days. The education at the public level, education at the academic level is so important. All of the people from the lower economic status from the higher to higher socio-economic status should be access to the data, to the education. Why? Because as you see at the B, action plan. Designing a public climate change early warning system is so important for education, as well as developing some programs such as this, Congress for having a comprehensive public plan for adaptation and developing some academic activities for climate change adaptation is so important. The second strategy that we find in our study is public participation. Without public participation, we can't, have a comprehensive action plan for climate change adaptation in our community. So there are three main actions that should be conducted concerning public participation. The first, fortunately, we have a lot of NGOs, we have a lot of CBOs that are active in the environmental issues, such as water management, I don't know, wastewater management, and soil management, and etc., etc. But we need to develop and organize a network of all of the NGOs. This is a missing, action that we should consider about it in our countries. The next is developing local organization and councils, such as city councils and village councils. All of this, local managers should be involved and should be engaged concerning climate change. They should be aware about the impact of climate change and how they can improve adaptation in their cities, in their village, in their communities. And the next, developing some community-based initiative. I'm sure that some of the lectures focus on the innovation that the community can develop for improving and promotion of adaptation in the community. The third, strategy is intersectoral collaboration and coordination. Unfortunately, all of the actors, such as Red Crescent, such as meteorological organization, Iranian, Ministry of Health in Iran, and other stakeholders have own plan, have own, actions and activities and program. But we need and intersectoral collaboration and intersectoral coordinations. When we are talking about the adaptation, we need to develop integrated climate change operational plan, as well as we need to develop and implement an unified interventional system. The next strategy is institutional development. As I said, we need to building some capacities in governmental structures, such as in the different forces, such as government, such as city councils, municipalities, and etc., etc. The next issue that's so important is developing of resilient and adaptive infrastructures. Unfortunately, some of our infrastructures, such as electricity, such as water system, are not resilient and are not adapted to the climate change. We need to change our insight concerning the infrastructures, developing and implementing our adaptive resource management, and revising and approving of adaptive rules and regulations at the national level and at the local level is so important. And the last one, but not the least one, is environmental preservation. We need to use some renewable, energies, such as solar panel, wind energy, and clean energies. This is so important and crucial for crucial for our country. In these days, you are facing a very bad air pollution in megacities such as Tehran. Focusing on the using of clean energies can solve this problem. And as well as the last one is using of land and soil stabilization mechanism in the desert and etc. The next issue that I want to mention in my lecture is about the cities. Why cities is so important? I mentioned some strategies at the national level, and I'm right now. I want to speak about the cities. The cities are so important. The cities are more hazardous and more vulnerable. Why? Because in the cities we are facing a phenomena entitled urban heat island due to the increasing the temperature in the cities, because the increasing the surface of the cities and the more pollutant that are in the cities. The statistics show that more than 40% of green gases are produced in the cities, and the most of the population in the world living in the cities. For example, in Iran, we right now more than 80% of the citizens and the population are living in the cities. So it is the adaptive cities and identifying the concept of climate adaptive cities is so important. uh, but in our studies that conducted in 2024, we tried to define the concept of climate adaptive cities and identifying the characteristic of climate adaptive cities and some challenges we are facing for improvement of the climate adaptation in the cities, and identify some strategies and actions to achieve this issue. In this slide, you can see the characteristics of climate adaptive cities, such as education oriented, effective resource management, foresight, comprehensive participation, as I mentioned in the previous slides, knowledge is so important, innovations, decentralized management, and low carbon economic in the management of the cities at the local level. And in this slide, you can see some strategies for climate adaptive cities. This is so similar to other actions that I mentioned in the previous slides. For example, the education and advocacy is so important. We need to conduct and we need to develop unified policy makings. There are a lot of different policies, different rules, different laws that somehow are against to each other. So it means that at the local level as well as at the national level, we need to conduct unified policy making systems. Research development is so important. Integrated planning, monitoring, and is so important. As well as I mentioned in the previous slides, we need to consider social intervention, economic intervention, health intervention and measurements, environmental actions, and architectural actions. Let me show you some pictures from adaptation in the ancient Iran. You see that Desful as a city in the south of Iran is very prone to climate change. And in our study, we noticed that there are a lot of yeah there are a lot of measures that can improve the level of adaptation concerning the architectures, concerning the building, and etc. etc. Our studies in this city show that when we are talking about the adaptive cities, we need to focus on the psychophysiological aspects and categories such as spirituality, physiological adaptation, mindset of the people is so important, and experiences. We need to use elderly experiences from to increase the level of adaptation in the cities, as well as environment is the second domain. Urban architectures, building architecture, natural capacities, and even the food diet. It's so important for adaptation in citizen. You can see some pictures concerning urban architecture in this city. This is Sabat in this full. This is Qomesh, and when the temperature is more than 50 degrees Celsius, all of the people live very well without any problem. Why? Because the structures and the architecture of the city was very well designed and were very adaptive to the temperature. This is Sabat and etc. Okay. The next issue that I want to mention is that when we are talking about an issue, we need to monitor, we need to assess the level of a phenomena such as adaptation, climate change adaptations. We developed in Tehran University of Medical Sciences an assessment tool to assess the level of adaptation in the cities. These tools have three main component: optimistic capacities with 10 questions, adjustment capacities, coping capacities, and response capacities. We assess the level of climate change adaptation in Ahvaz city in south of Tehran, and you can see the different level of adaptation in the cities. This is the region at the regional level, and this is at the neighborhoods in cities. Why this is so important? Because this is so important when we can, plan. We should know about the weaknesses. We should know about the strengths, and other issues can help us to develop an evidence-based, plan for conducting and improving the level of climate change in the cities. And finally, I want to introduce you an action plan for climate adaptive hospital. If I have some minutes, sometimes. What's the problem? All of us work in the health system, in hospitals, and the hospitals are so important. If we imagine that the healthcare is a country, okay, the health system is the fifth large emitter of CO2 in the world, and the statistics shows that the 5%, more than 5% of global CO2 emission is related to the healthcare system. So we need to set some actions for reducing the CO2 emission in the health system, especially in the hospital, and conduct some action plans for increasing the adaptation level in the hospital and healthcare systems. Although we know that there are different, programs, there are different, framework concerning the environmental issues such as GGHIH or other, program that introduced at the global level, but none of them focus on the climate change. And we need to develop an action plan, an action framework for hospital to deal with climate change. This is the methodology. We conduct a very comprehensive and systematic literature review, and then we continue with qualitative study, and then merge all of the results in a meta-reference study, and then we finalize our framework by using a Delphi method. The results in this slide. We have mitigation strategies such as water consumption management, wastewater management, energy management, chemical material management, transportation, nutrition, pursuing policies and sustainable care models. I want to focus about the adaptation strategies. You see that concerning the adaptation strategies, we have 5 main action plan. You can see in this slide as a general uh, image. Concerning the first action plan about the technology, we need to use e-health, health information management, and health information systems. Telemedicine can adapt our system, our hospitals, to the climate change, as well as emitting is so important for consumption, CO2 consumption and adaptation in hospitals. We need to use artificial intelligence, virtual reality, and augmented reality. All of this, program and all of these instruments can help us to increase the level of adaptation in our hospital. The second is financing. As the Sendai framework for action mentioned and emphasized, the financing is so important. We need to invest for climate adaptation in hospital, as well as develop insurance system and financial incentive. The third one is monitoring and evaluations. As one of the most important and the core of all, and the core of all of the actions, always and always and always, we need to assess the level of hospital hazard and vulnerability assessment and monitor all of the hazards in the hospital. And we should monitor and assess the level of hospital adaptation and monitor. Early warning system are so important. CO2 emission monitoring system is crucial for hospital, and energy monitoring is so important. The next is leadership and management, such as coordination system. We should conduct some hospital emergency operation centers, hospital incidents command systems. In hospital communication is so important. Resource management and planning and education are so crucial for hospital. And the last one is constructions, hospital construction. As I mentioned in the previous slides concerning this school, the construction and the architecture of hospital is so important. The location of hospital that we select to construct a hospital is so important, as well as building design. Can some of the designing in the building can increase the level of adaptation in the hospital, and hospital accessibility are so important. As the conclusion, there are a wide range of effective strategies to limit greenhouse gases emission of hospital, has mentioned in this framework, as well as a wide range of effective strategies for increasing the level of adaptation in hospitals concerning the climate change, are so crucial for all of this, health worker staff that are working in the hospital. And using this framework, we think that this framework will enable hospital manager and worker and professional, and as well as decision makers, to achieve the goal of the Paris Agreement. I think this is the last slide. When we are talking about the preparedness, when we are talking about the healthcare, climate-related preparedness, recently we developed a new model concerning the, healthcare. And as you see, we named this model as the 3C, because we have 3C: context, The second is content, and the third is consolidation. The context, this is the core of every planning, every kind of planning for improving adaptation and improving the preparedness of hospital and healthcare, combating with the climate change. The first is risk assessment and risk planning concerning the context. I'm sorry. The resources are so important. Search capacity should be considered. Incidence management and early warning system in telecommunication and health information systems are so crucial to be considered in health in every kind of healthcare systems. And then, as the component of consolidation, without education, without communication, without conducting some exercises and maneuvers, we are not sure that our plan is conducted and is confirmed and consolidated in our system. Uh, I think my time is finished, and I'm so sorry that I have no time to, present the second lecture concerning refugee health. Anyway, thank you so much. Over to you.
خانم مهندس. Thank you very much, my dear colleague, Dr. Ostad Taqizadeh. I really appreciate your brilliant presentation. Actually, it was an exceptional one, and I really enjoy your presentation. Also, I would like to express my gratitude to accept our invitation to be as one of our keynote speakers in this conference. Thank you very much. Dear Professor, you provided us with valuable and insightful topics in your presentation. As you mentioned, climate change is a main threat for health today, and we as nurses and midwives, as healthcare professionals, we are committed to take actions to address the unique needs raised by the climate change. I want to mention the American Association of College of Nursing, that this topic also is highlighted based on American Association of College of Nursing. Based on this association, the impact of climate change on environmental and population health should be considered as a competency of nursing education domain. And we have to consider this in our curriculum and take actions to integrate these topics in our nursing and midwifery curriculum too. I want to summarize the valuable points you brought up today. You highlighted about the climate change adaptation domains. You raised about the climate change adaptation strategies in Iran, including education, public participation, intersectional coordination, environmental preservation, which all were very comprehensive and insightful for all of us. One point was very interesting for me, that you mentioned that the cities are more vulnerable regarding the production of greenhouse gases. And as you mentioned, more than 40% of greenhouse gases are produced in cities. Also, you went over the key points on strategies for climate change adaptive cities. That was very interesting and informative for all of us. And also, You highlighted the telehealth, which also is one of my favorite research lines, research topics. And I worked on telehealth and e-health. And I think we should, at first, we should have the required infrastructures to be able to apply e-health and telehealth um, in Iran. Uh, so to make it applicable, I think we should take a long journey. Thank you very much. And I want also to add a quote, as Charles Darwin noted, it's not the most intelligent beings who survive, it's the most adaptive ones. Thank you very much. And I hope that we will have the chance to have you with us in our future programs. Thank you.
Thank you so much, and as well as I would like again all of you to conduct this so important and informative congress. Thank you.
Thank you very much, Dr. Taqizadeh. There's one question from the chat box if you have the time to answer it.
Yeah.
One person asked how artificial intelligence can facilitate adaptation of climate changes to the hospital and healthcare systems. They're all yours for you, Doctor.
No, thank you. Could you repeat it? I'm sorry.
They asked how artificial intelligence can facilitate adaptation of climate changes to the hospital and healthcare system.
This is so crucial questions. I just can't answer very well to this, questions because I have no time to go to the detail of our studies. And when we use, virtual educations such as artificial intelligence and so on, we can adapt all of a program with climate change. For example, imagine that you are facing to heat wave. Imagine that you are facing to air pollution. Imagine that you are facing in dust storm and flood. Okay, such that we experienced during the COVID-19 period. At the first time, all of the educational activities in the universities, in the schools, was disrupted, and we can't go to the universities. But after that, after a while, we change our action, our strategy for education. We try to use different ways for education, for increase the education in the cities, in the schools, such as using virtual education or mixed method educations, including artificial education. As I understand, the artificial education, conducting some e-meeting and etc., can increase our adaptation where when we are facing to climate-related disasters such as flood, dust storm, heat wave, and etc.
Thanks a lot, Dr. Ustad Taqizadeh. I really appreciate your presence. This is really important that in this Congress we had a lot of experts from different countries and also from different faculties. As we all know, and our experts mentioned, this is an interdisciplinary subject. So, thanks a lot. Now I'm going to invite our next speaker, and we're really glad to have her. I want to invite Dr. Shirin Shahbazi Sigalde, who is an associate professor in reproductive health and midwifery department, School of Nursing and Midwifery, Tehran University of Medical Sciences, Iran. So, Dr. Sigalde, are you with us?
Yeah,
Do you have
hello. Good morning.
hello?
Do you have my voice clearly?
Yes, we do. And I'm sure that although this is a interdisciplinary subject, this is especially
Yeah.
fruitful for midwives and midwifery students. So we're all ears and eager to hear you.
Yeah. Could you please share my slides?
Sure.
It's share.
We're
I cannot
sharing it
see
right
them.
now.
Yeah, thank you. Thank you so much.
You're welcome.
In the name of God, hello to all audiences and professors, and thank you for organizing this interesting international conference. I'm Dr. Shireen Shahbazi, professor of the Department of Midwifery and Reproductive Health, Tehran University of Medical Science, and I'm very happy to be present here at this time at this great conference. The title of my speech is, let me read breastfeeding, planetary health, and the vital role of midwives in a sustainable future. I can change that, yeah. At first, let me review the description or definition of planetary health. Planetary health has been defined as the health of human civilization and the state of the natural system. One of the issues that is related to the health is nutrition, and nutrition also could be related to planetary health. WHO says nutrition is a critical part of health and development because better nutrition can improve infant, child, and maternal health, can lead to a stronger immune system, safety pregnancy and childhood, and can lower the risk of non-communicable diseases, for example, cardiovascular diseases, hypertension, or diabetes, and can lead to longevity. And also the 23 SDG Target 3 says only access to safe and nutritious food will ensure healthy lives and promote well-being for all. The Atlantic Commission has introduced a kind of diet that is planetary health diet, and this kind of diet is compatible with planetary health. What is the definition of planetary health diet? It is a flexitarian diet which is largely plant-based, but can optionally include modest amount of fish, meat, and dairy foods. It says that mostly we have to use foods that they are plant-based and at least amount of fish, meats, and dairy foods, we have to use them. Because plant-based foods can augment personal health and simultaneously can lessen worldwide food scarcity, pollution, and climate change, thereby they could improve planetary health as an indirect consequence. The Atlantic Commission says a healthy and sustainable diet largely composed of whole grains, fruits, vegetables, legumes, nuts, and unsaturated oils, and a moderate intake of seafood and poultry, and a reduction or elimination of red meat, processed meat, added sugar, refined grains, and starchy vegetables. However, these reference targets apply to children 2 years and older. But for children, for children below 2 years, WHO and UNICEF recommends for optimal infant and young child feeding practice, that is breast mother feeding. The abbreviation of breast mother feeding is BMF. By early initiation of BMF within 1 hour of birth, by skin-to-skin contact after vaginal delivery or after cesarean section, and exclusive breastfeeding for the first 6 months of life, and also continued breastfeeding up to 2 years of age or beyond. Because breastfeeding has some lifelong positive health effect. For example, when a woman has breastfeeding, this breastfeeding can help the mother to delay early return of fertility, can help birth spacing, and also can reduce the risk of some cancers among women, for example, breast cancer and ovarian cancer, can decrease the possibility of postpartum depression and hemorrhage, and can lower the risk of hypertension. And among children, breastfeeding can guarantee food safety and secure attachment. And this is the first vaccine for baby, because help the baby combat some dangerous infections like lower respiratory infections and also diarrhea. Diarrhea and lower respiratory infection, they are two most important reasons for infant mortality. And breast milk can prevent these dangerous diseases. And also breastfeeding can prevent dental caries among children and increase their intelligence score. Also, breastfeeding has benefit effects on society, and it could lead to societal development, because breastfeeding is estimated to generate $35 in economic returns, and it can be considered a global food production system. Globally, rates of exclusive breastfeeding, that the abbreviation is EBF, has increased by 10% over the past decade. And in 2023, the rate of EBF, global rate of EBF was 48%. And this value was close to the World Health Assembly target, that is 50% by 2025. Among all the countries in the world, Rwanda, that is an African country, has the highest rate of EBF in the world, and the EBF in Rwanda is almost 80%. And Ireland has one of the lowest rates of breastfeeding, both globally and in Europe, and it is only 15%. In Iran, according to a recent systematic review, the overall prevalence of EBF is 53%. But unfortunately, despite extensive evidence supporting breastfeeding economic, social, and health benefits, some indicators of infant and young children in feeding practice, such as EBF and continue breastfeeding at 2 years of age, still fall below global targets. We know that breastfeeding should always be the primary choice for initial feeding of the baby. But in some specific cases, for example, when the mother has some dangerous viruses that can be transmitted to the baby by breast milk, for example, when the mother has HTLV type 1 and type 2, or HIV or TB, or when the baby has some metabolic diseases like galactosomia, alternative options for breast milk could be safer, for example, donor milk or formula. And these safe alternatives can be recommended by unbiased healthcare professionals, but free from commercial interest. Unfortunately, since the mid-20th century, some economic, demographic, and socio-cultural factors have driven an increase in commercial milk formula consumption. It says that maybe many babies who are feeding by formula, they are using formula because of commercial, because of advertising, and maybe easy access to formula, not because of a medical reason. A 2016 study published in Public Health Nutrition drew attention to unprecedented global transition to milk formula for infant and young child feeding, particularly in developing countries, in some Asian country and Pacific region. And this boom in milk formula sales and consumption is attributed to some factors, for example, lack of maternity protection or supporting for breastfeeding, unregulated company marketing of baby foods, and inadequate support for breastfeeding by health services and health professionals. And this latter, the third one, is very important for midwives. Maybe another reason for this boom of formula feeding is that mothers don't have enough knowledge about the risk of formula feeding. What are the risks of formula feeding? Higher risk of SIDS, sudden infant death syndrome, higher risk of obesity, higher risk of diabetes, higher risk of childhood cancer, for example, leukemia, during childhood. High risk of heart disease, high risk of chronic disease, high risk of ear infections, allergy, asthma, and diarrhea, and also risk of lower intelligence. And the risk that is important for this conference is higher risk of effects of poisons of formula in the environment. Because commercial milk formula is primarily produced from cow's milk, there are concerns about its environmental impact. In food system, dairy is the second large greenhouse gas emitter, or GHG emitter, after meat. The first one is meat, and the second one is dairy that can produce greenhouse gas. Carbon dioxide, methane, and nitrous oxide are examples of the greenhouse gas, or GHG, produced by man-made activities. A 2015 study showed that GHG emission for a kilogram of milk formula was around 4 kilograms. This excluded emission after the manufacturing stage, such as arising due to packaging, transporting, preparation, and refrigeration of formula. Methane, nitrous oxide, and also carbon dioxide, they are named greenhouse gases because they act like the glass of a greenhouse and trap the heat of the sun's rays. They are also compared to a blanket or a thick quilt which absorb heat of the earth and re-emit this heat in a random direction. And the effect of this random redirection of the atmospheric heat traffic is to impede the flow of heat from the planet, just like a quilt. It says that greenhouse gases don't allow the heat of the earth escape from the earth, and they keep the heat around the earth. And because of this, the earth is becoming warmer day by day. But breast milk not only safeguards the health of infants and their families, but also benefits the environment by minimizing GHG emission associated with unnecessary consumption. As the breast milk is a natural food source, breastfeeding can also help to achieve some targets of SDG 23, for example, SDG 12.3. This target says that we have to diminish food waste and diminish food loss. So by using breast milk, we could achieve this target. We could diminish food waste and diminish food loss, because breast milk is the best kind of food for baby. Breastfeeding is climate compatible. It is a low carbon and clean green solution. Breastfeeding keeps the environment unharmed. This is because breast milk is neither industrially manufactured nor ultra-processed. And breastfeeding has also zero water footprint. What is water footprint? Water footprint is the volume of fresh water used for production of the goods and services. For breastfeeding, we don't need any fresh water for producing breast milk or for consumption of breast milk, because breast milk has enough amount of water, so we don't need to use fresh water. All that a baby needs for the first 6 months of his or her life is breast milk, and not a single drop of water is needed for breast milk. Because of this, scientists said that breastfeeding is zero water footprint. Yeah, I think that you have to back to, yeah, and next slide, please. Mothers who exclusively breastfeed their babies and continue breastfeeding up to 2 years have delayed fertility. I told you that one of the benefits of breastfeeding is decreasing the fertility of the mother. And these mothers experience delayed menstruation for an average of 14 months. So these mothers, because of this delayed menstruation, need fewer menstrual pads and tampons. And also their babies need less nappies or diapers. We know that after we use these menstrual pads and nappies or diapers, there are some waste materials that could pollute our environment. So by breast milk and by this delay in menstruation, mothers could protect the environment. Could you go to next slide, please? Breastfeeding produces zero waste. It means that it doesn't have any waste. In comparison to formula, as there is no waste from the packaging, we don't need to package breast milk in comparison to formula. For formula, we have to produce formula, we have to pack formula, but breast milk, there is no need to packaging. Or in breast, when we want to give the baby our breast milk, we don't need any plastic feeding bottles or plastic water bottles, because we could hold the baby and give the baby our breast milk. We don't need to use any plastic bottles, or we don't need to use water bottles for changing this powder of formula to the liquids. But so when we are speaking about formula, we have to consider two important things. The first one is some inputs or resources that we needed for producing formula, and also we have to consider the outputs or waste products of formula. And this picture shows the pollution and the waste materials because of some man-made activities, for example, formula processing and producing. Formula feeding leaves a large, heavy ecological footprint. What is ecological footprint? Ecological footprint includes the resources consumed by the human population, as well as the waste left behind. And formula has a large, heavy ecological footprint because for producing formula, and we need many resources, and also for after using formula, there could be some waste materials. So in formula, the carbon footprint of greenhouse gases contribute to climate change, because formula for the manufacturing and producing formula can produce some greenhouse gases. So it can change the climate. And also there would be some waste and garbage that pollute our environment.
Sorry, Dr. Shahbaz, sorry for interrupting you, but it would be really good if you could sum up your speech, please.
Okay. We need cans for packing the formula, tin for cans, plastic for bottles and teats, and labels and printing for marketing and distribution of formula, and sterilizers for sterilizing the bottles for formula. This puts a burden on the planet additional to that of manufacturing formula from liquid milk. Babies, especially the babies who are under 6 months of age, cannot take milk in any form except liquid. And producing formula involves turning liquid milk into a powder, and then we have to use water to turn it into a liquid again for consumption. So we have to use a lot of water, fresh water for formula. So At each stage, producing a formula, transporting a formula, manufacture of feeding bottles, reconstituting formula into a liquid that the baby can use it, can consume. There is a huge requirements of energy, most often causing irreversible damage to the environments. The processing and packaging of formula products formula produced some chemicals, pollutants, and toxins, all of which have a detrimental effect on our environment. For example, aluminum, cadmium, and other metals are used in manufacturing, storage, and packaging of formula products. The inner packaging of the formula boxes is plastic and aluminum foil laminated. And the processing and recycling aluminum are both energy intensive, and contamination caused by aluminum for packaging of formula is also a cause of concern.
We're so sorry. Yeah, I know. We're so sorry for interrupting you again, but unfortunately, we're a little bit out of time. So I'm going to ask.
Only 3 to 4 minutes is enough.
That's okay. So, we're going back to your slides.
Okay, thank you. Yeah, and many of the formulas are packaged for sale using aluminum-based materials, and this is evidence of immediate and delayed toxicity in infants, and especially preterm infants who are exposed to aluminum, especially formula formula that is soya-based formula, because this kind of formula has high content of aluminum. What we have to do for encourage breastfeeding? There are some action ideas for encourage breastfeeding. The first one is sensitizing policymakers about the heavy ecological footprint of formula feeding and the positive contribution of breastfeeding on the environment. And the second one is synthesizing ecologists, religious leaders, journalists, and decision makers who are involved in setting the SDG targets. And the third one is calculating country level data for the external costs or externalities of formula feeding. And the last one that is very important for midwife is orienting mothers, families, and caregivers about the positive effect of breastfeeding on our environments. Breastfeeding is, we have to tell the mother breastfeeding is one of the best investments for saving the lives of your infant and improving the health, social, and economic development of individuals and nations. And supporting breastfeeding has short and long-term impact on planetary health. So by creating an enabling environment for optimal infant and young child feeding patterns, we could also reach to planetary health. And this is a societal imperative and social necessity. Social support is very important for encouraging breastfeeding, and all women and parents have the right to be supported by society. And this support can be given by families, communities, health system, and workplaces. Also, breastfeeding education is very important. Next slide, please. Breastfeeding education. This slide shows, at first, let me explain this slide. This slide shows the theme in 2024 in World Breastfeeding Week. The theme of this Breastfeeding Week in 2024 was Closing the Gap, Breastfeeding Support for All. This shows the importance of supporting breastfeeding. And another thing that's very important is breastfeeding. This is 3 or 4 slides. And they are very interesting. Can I continue or not? Yeah. Okay. And breastfeeding counseling is very important. And during this counseling, we have to give information about breastfeeding, and also we have to giving practical help and demonstrating how the mother position and attach a baby at the breast and manage common problems of breastfeeding, for example, breast engorgement and others. And this picture is a symbol of breastfeeding. This is the international breastfeeding symbol that was designed by Matt Deigel, a graphics artist, in 2026 during a contest. And when you see this picture, you have to know that this is the international breastfeeding symbol. And one of the symbol of breastfeeding is tree. Trees symbolize the interconnection of all life on our planet, and tree of lives is a universal symbol of interconnection of all kinds of life. And breastfeeding, there is a connection between breastfeeding and tree. Tree of life is in some Asian and Arabic countries is like a powerful image. We are respected trees because trees gives us our food. They gives us oxygen and can absorb carbon dioxide. Because of this, tree of life breastfeeding could be like a tree because they give the baby life. And also breastfeeding can be sustained without any harm to Mother Earth. And because of this, it is proposed that every breastfeeding mother should be awarded a golden leaf to symbolize her contribution to the health of her baby and the health of our planet. And please show the next slide that is showing the tree of life.
Dear Dr. Shirin Shahbazi, thanks a lot for your wonderful presentation.
Okay, show only the last slide. It was very interesting.
Yes, it is. It is really, really interesting. And this topic is very important, especially it's very important for our midwifery students to know how practically they can get involved in the planetary health.
Okay, thank you. Thank you so much.
It was really, really interesting for us. And we got a lot of notes here. We had a lot of discussions. And it's really a way forward to think that we can empower mothers to have more breastfeeding for our planet, not only for the health of mother and child, but for having a healthier planet. It was really, really interesting presentation. We all really enjoyed it. Thanks a lot for presenting for us. And if you allow me, I would like to move to our next speaker, Dr. Ebrahimi. Thanks again for accepting our invitation to present it.
Okay, thank you so much. I would like to thank Dr. Manukian, Dr. Nikpema, and my good students, Bahar Niyusha and other students, and also thank the Vice President for International Affairs of the university. Thank you. Goodbye.
Thanks a lot. Thanks.
Hello.
And now we are giving the floor to Dr. Ebrahimi. Hello, Dr. Ebrahimi. Thank you for accepting our invitation to present in this conference.
Hello, please accept my thanks for your effort for conducting this valuable program for the university students and the health provider teams. If it is possible, I want to share my slide. Is it possible for you? Do you have my voice? I want to share my slide by myself.
Perfectly, and then yeah, we could see your slides as well.
Can you see?
Yes, it's perfectly visible.
It is shared now?
Yes, it is.
But I cannot
Dr.
see my
Ebrahimi, if you
slide.
allow us, we would like to introduce you to our participants.
Yeah. In the name of God, dear audiences and esteemed executive team of the program, I thank you for your presence and attendance to this valuable program. I am Dr. Elham Ebrahimi, the Associate Professor of Reproductive Health in Department of Reproductive Health and Midwifery of Tehran University of Medical Sciences. Now it is my privilege to continue the discussion on the topic of planetary health and perinatal health. And I hope that by the end of this presentation, we all reach to a deep insight on the importance of planetary health and or possible role for
Dr. Ebrahimi, I'm really
preserving that.
sorry for interrupting you. Because you haven't gone to the full screen mode, we cannot see that you're changing your slides. I would really appreciate if you could
Can you
just
see
answer.
my slide now or no?
We can see your slides, but there is no change. I think that's if we.
It is freeze. I didn't change my slide. Now I want to change.
Thanks a lot. Thank you.
It is changed now?
Can you? Yes, of course. But can you please change it
Okay.
into full screen for a better
Yeah,
view?
yeah, sure.
Perfect.
But
Thanks.
before starting, sorry. Before starting the topic, let me have a short review on the definition of planetary health. But my colleague, especially Dr. Shahbazi and Dr. Ustad Tagizadeh, rightly pay attention to the definition. But it is needed for the audiences that present to the conference now. From the aspect of definition, planetary health refers to the study of interconnection between human health and the health of the Earth's natural system. And it focuses on how environmental changes such as climate change, biodiversity loss, air pollution, water pollution impact on human health. The other topic that we want to review on its definition is prenatal health. What is prenatal health? Prenatal health encompasses the health of both mothers and their infants during pregnancy, childbirth, and specifically in the early postnatal period. What is the importance of prenatal health in planetary health topic? We know that these days all countries around the world have an effort to reach to sustainable development. And we know that the first step for having a sustainable development is a healthy human. And the healthy human is an axis of sustainable development. And among the group of human, we should focus on two vulnerable groups, mother and child. And because of that, because the prenatal health focuses on the health of pregnant individuals and their newborn, it is important for reaching to planetary health. The other topic that is more important than the prenatal health is reproductive health. And the reproductive health can be considered as a mother of prenatal health. How reproductive health affects on the planetary health? Because one of the topic in reproductive health is family planning, and we know that according to the human activity, the health of the planet can be under the threat, and because of that. Because the family planning helps the human to choose the number and timing of their pregnancy, it can lead to control the trajectory of population growth in the future. And because of that, it needs to multi-sectoral approaches to balance the needs of people and the planet. As I told you, the human activity can lead to some effects on the planetary health. Factors contributing to greenhouse gas emission in the human activity include three categories. The first category is related to energies, anesthetic gases, and disposable supplies. And when we, as a health provider, when we want to help to the planetary health, we must focus on these areas. For example, the recent research focused on some strategies for controlling these three types of elements. For example, in one research, they pay attention to that decreasing single use of disposable supplies in and outside of the operation room, and education and advocacy can control and can help the planetary health. And one of the topics that is very interesting for the midwifery student is vaginal birth. And according to the research article, encouraging the woman for choosing the normal vaginal delivery can directly affect on the planetary health. And also a specific study comparing the vaginal birth with cesarean delivery and showed that a cesarean delivery used a far more disposable supply and thus has had a large environmental impact compared to the vaginal delivery. And the other aspect that we can focus on that is this fact that the vaginal birth can be associated with a lower carbon footprint. And the other advantage strategy is using a surgical pack and try inventory for various procedures. It can be very useful and contribute to reducing waste things in our planet. And also, in the obstetrician and gynecology can use a stainless steel speculum instead of disposable speculum. And according to the report of article, a stainless steel speculum were 4 times lower than the disposable speculum in producing the carbon footprint. As I told you, one of the important area in the planetary health is climate changes, and climate changes directly can affect on the human health and in the health of the mother and child. Climate change refers to the alteration in global and regional weather pattern over time. These changes can occur naturally or as a result of human activity. Some of the natural changes that can lead to the climate change including the solar activity, volcano eruptions, and variation in the Earth's orbit. But the majority of the cases of the factors are directly related to the human activity. And some activities such as fossil fuels, deforestation, and industrial process can lead to the climate change. What are the consequences of the climate change? It can lead to rising temperature, sea level rise, increased extreme weather events, and impact on ecosystem. And all of these consequences can lead to human health impacts. According to the project that conducted by WHO, 250,000 additional deaths occurs due to climate-sensitive disease for the population between the 2030 and 2050 years. And also, the other article that conducted in 2020 year showed that near 132 natural disasters, including floods, storms, and droughts, affect the health of near 51 million of people around the world, and it could lead to 3,000 deaths among the world. And also, the other consequences of climate change is wildfires. For example, in the United States, during the year of 2020, near 2 million individuals affected by the wildfire consequences. And in this slide that designed by WHO, easily you can see the pathway of climate change on the health of human being, that nature. One of the direct cause of climate change is increasing the vector-borne disease. Some of the disease that can be seen in this category is Zika and malaria. And especially in the recent decades, we were the witness of the consequences of these two types of vector-borne disease on the health of the pregnancy. For example, the Zika and malaria can increase the rate of preeclampsia, HELLP syndrome, preterm birth, lower fetal birth weight, mother-to-child transmission of the disease, and fetal congenital malformation according to the studies. And also, the climate change can increase the rate of fungal disease. And you know that because during the pregnancy, the immunity level of the pregnant mother decreases, they are susceptible to get these types of disease. And also, the other cases that the midwives and obstetrician encounter with them in the area of the controlling of vector-borne disease are related to the medication. For example, two famous medication, doxycycline and chlorphenicol, can have direct consequences, side effects on the health of the pregnant woman. And because of that, we have a lot of problem for controlling of these types of disease. And also, climate change can lead to flood and storm disaster in the world. And according to the result of two systematic review, the woman that experienced the hurricane, flood, and a storm during the pregnancy developed the mental health condition, including depression and post-traumatic stress disorder or PTSD after the childbirth. And also, the flood and storm disaster can increase individually the rate of preterm birth, maternal and fetal mortality, and low birth weight. And the other interesting result of the climate change is related to increasing the saline in the water. We know that one of the consequences of the climate change is rising the sea level. And because of this consequence, we have the intrusive inland into local water sources and increase the salinity of both surface and groundwater. And because of that, using of these two types of water by the pregnant woman can increase the risk of both gestational hypertension and preeclampsia among them. And additionally, in infants, high salt intake is associated with higher systolic blood pressure. The other area is related to air pollution. Air pollution directly affects on the fecundity. And according to the result of the article, we have a global trends over the past 50 years indicate a decline in fecundity, characteristic by decreasing sperm count and motility, increasing rate of miscarriage and preterm birth. And also, the air pollution can affect on the spermatogenesis, and we have impaired spermatogenesis among the among the men that had exposure to chemical and toxic material. And the other interesting result that pay attention by the article was that among the women that live in the area that are closer to the major roadway experience a lower probability of successful implantation and live birth. And because of that, we must control the air pollution in the world for receiving to high frequency of successful in IVF program. And also, air pollution can increase some maternal outcome, especially hypertensive disorders among the pregnant woman, and also it can increase the rate of maternal abortion in the first trimester of the pregnancy. And among the fetus, the air
Sorry,
pollution
Dr.
can
Ibrahimi.
increase the
Sorry to
yes,
interrupt you. We are
my
behind the
time.
we are behind the timetable, so I wanted to ask you if it's possible for you to summarize your speech in 2 minutes or so. Is that possible
Just
for
I
you?
think, yeah.
Thank you.
Just
Thank you
five
very much.
slides. I think it remained. Okay, among the fetus, so that I have to increase my speed. Sorry for this. I mean that this elapsing the time. Among the fetus, air pollution can increase the risk of preterm birth, and also it can lead to the congenital heart defects and abnormal developmental consequences among the fetus. And also, the high temperature are one of the other consequences of the mm, I mean that um, um,
Dr.
planetary
Ibrahimi, is
health,
there any problem?
dementia, and maternal health pregnant woman. And also, it increases. No. Do you have my voice?
No, I do. I thought that maybe there was some technical problem happened to you. If okay, you can
No,
continue.
no. I don't have any problem. If you have my, can I continue?
Sure, but briefly, please. Thank you.
Okay. And among the fetus, the high temperature can increase the rate of preterm birth, stillbirth, low birth weight, and increase risk of hospitalization among the newborn and infants. And as I told you, the climate change is one of the major effects, and it is one of the most important topics in the subject of planetary health, because it increases the preterm birth, low birth weight, stillbirth, and effects on brain development among the fetus. Because of that, the planetary health is equal prenatal health, and we must give the strategy according to the topics that we had in the previous presentation by my colleague Dr. Abbas Tagizadeh. Because of that, we can control and we can have an important role for controlling the air pollution, water pollution, and the other area of hazards in our that environment for reaching to the prenatal health. Thank you for your attention.
Thanks a lot, Dr. Ibrahimi, for summing up soon. So we are going to our next speaker because we're really short of time. I want to invite Dr. David Bermejo Martinez, Assistant Professor, Nursing and Physiotherapy Department, Faculty of Health Sciences, and University of Leon, Spain. At first, I would like to apologize you for the delay happened. Sorry, we're a little bit out of the timetable. And I'm going to read your topic to our audience. So, Dr. Bermejo's topic is network analysis and understanding sexual networks, patterns in drug use, and their relation to planetary health. So the floor is all yours.
Thank you very much. Good morning, everyone. I'm honored to be here as one of the invited speakers at the International Conference on Planetary Health. I would like to express my sincerest gratitude to the organizers for inviting me to participate in this significant event. Let me introduce myself. My name is David Bermejo. I'm a nurse specialist in family and community care and an assistant professor at the University of Leon. I would like to introduce you to the Salvis Research Group, an interdisciplinary team based at the University of Leon. Our group focuses on combining health, well-being, and sociosanitary and sustainability through the analysis of the networks. By applying cutting-edge methodologies and tools, we aim to address critical challenges in healthcare systems, public health, and community health. Our work spans in two areas, such as social network analysis, studying relationships and connections to identify solutions, and data science and artificial intelligence, applying advanced analytics to health outcomes. Our key areas of focus include health research, data analysis, and public health and sustainability, promoting a sustainable approach to health system and community care. By connecting ideas, people, and data, Salvis contribute to the building more efficient, inclusive, and sustainable health system for the future. So let's start with the presentation of today. The objective of this presentation is to explore the intersection of sexual health, substance use, and public health within the broad context of planetary health. We will focus on understanding how sexual networks and in innovating approaches such as social network analysis can help identify key partners and solutions. Let's delve into the challenges, opportunities, and strategies that connect public health and sustainability in this crucial area. Let's start with the basic. What is a network? A network is a structure composed of nodes and links. Nodes represent entities such as people, organizations, or places, and links represent the relationships or the interactions between them. Networks are all around us. For example, include transportation networks, social networks, and even neural networks in the brain. They are essential for understanding relationships, behaviors, and information flows in various contexts, including, obviously, healthcare. Now, let's explore the key characteristics of a network. Interconnection, for example, in neurons, nodes or entities are connected in an organized way to allow the flow of information, results, or behavior. Structure in green, network can take on different forms, hierarchical, top-down, decentrality, or another more. Directionality in blue, links within a network can be unidirectional or bidirectional. I can see this later. Density in purple, this refers to how many connections exist in the network compared to the total possible connections. And the last in another green, the centrality, central nodes or key individuals play an important role in the network. They influence communication, resource flow, and group dynamics. To better understand the concept of the network, let's look at a few examples from different areas. For example, social networks. This network connects people through relationships like friendship, family ties, or professional links. They are essential to study human behavior, communication, and obviously health dynamics. Computer networks that include system of connected devices like routers and servers, transportation network with systems such as railways, lines, roads, or flying paths, and obviously biological networks like DNA sequences or neuronal connections. Each of these networks demonstrate interconnectedness and how the structure of these systems influence their functionality and outcomes. Networks are fundamental to understanding and improving the systems around us, whether they are social, biological, technological, or physical. The importance of networks lies on their ability, for example, to facilitate communication, to analyze relationships, to model complex system or to address social challenges. In health networks are particularly relevant, taking disease transmission, for example, improving care delivery and fostering collaboration within community and institutions. Okay, let's difference between direct and indirect networks. Direct networks, in these networks, the links between nodes have a clear directions. For example, communications such as an email or a one-way message flows in a single direction from one node to another node. This is often represented with a round to show the flow. And the undirected networks, the connections between nodes are mutual with no specific direction. For example, a friendship or collaboration between two people is usually a two-way relationship where both parties interact equally. Understanding the difference between direct and indirect network is essential for analyzing how information, influence, or resource flow through a system. Let's know the difference between egocentric versus sociocentric networks. In ego-centric networks, these networks are centered around a single individual, referred to as the ego. The connection or alters represent the relationships the ego has with others alters, but this connection might not interact with each other. For example, personal close friends or professional contacts. Here in this imaging represent the concept of egocentric network. Egocentric networks are used to study personal relationships, social support system, or resource flow around a specific individual. For example, examining healthcare providers give us insight into their immediate network and that's impact on their behavior or well-being. Here, these images represent a sociocentric network where we observe the overall structure and connections between different groups of nodes. For example, medical in blue, nursing in green, and auxiliary staff in red. Some key aspect of this type of network is the clusters. The nodes from distinct cluster interact in internal connection within groups. Another important thing is the breeding nodes. For example, some nodes like Mary or Hada act as bridges between cluster facilitation, communication, or resource flow. This visualization emphasizes how understanding sociocentric networks can help identifying influential connections, improve teamwork, optimize network workflows in healthcare or organizational environments. The last difference is between type 1 and type 2 networks. On type 1 networks, which are defined as networks that connect individuals to individuals. These networks emphasize the relationships between people, creating direct connections that illustrate social, professional, or personal interactions. Some key points is that it's a person-to-person connection. This network exclusively links individuals. For example, friendship network, professional network, communication network, and things like that. We have a lot of application, for example, in health to identify pathway for spread of informations or disease, or in social science, mapping social interaction with groups to identify leaders or isolated individuals, cluster, and so on. Type 1 networks are essential to understanding human connections and the dynamics that emerge from individuals' interactions. In the other hand, type 2 networks, also referred to as an affiliation network, and it's which connect individuals to other entities such as places, events, organizations, and we have some key features of type 2 networks. For example, these networks illustrate how people are connected through shared affiliation or common association. For example, individuals connected to hospital, to university or clubs, or people participating in sharing activities like us here today in this conference or in workshops, things like that. And in health, for example, identifying shared space where disease might be spread. By analyzing type 2 network research can uncover the intersections between individuals and large systems, shedding light on how affiliation impact behavior, resource access, or group dynamics. In these sections, introduce social network analysis, a methodological tool for studying relationships and interactions between individuals, groups, or entities in general. Social network analysis help us to map and analyze the structure of these connections. In practice, it's applied across various fields, including public health, sociology, and organizational management to optimize interventions. It's an analytical approach enable us to make data-driven decisions based on a real-world network dynamics. I want to go fast. Okay. We have two principal methods to use in this social network analysis. First one, quantitative methods. These include statistical and mathematical techniques used to measure networks properties such as density, centrality, and clustering. These methods help quantify relationships and patterns. And the other one is visual methods that through the visual tools such as network graphs allow research to see the structure and their relationships within a network at a glance. Visual represent helps identify cluster, central nodes, or flow patterns. By combining these two methods, social network analysis provides a comprehensive understanding of networks, enabled research to analyze the dynamics of the relationship and their impact in various contexts, such as obviously the health. We have a lot of popular software tools for this social network analysis. I only want to point out my favorite is the UThiNet for the analysis, but for example, GEFI is another very good software to represent the networks. I want to show you directly the some example here. In this guide is designed to support those involved in planning and implementing vaccine rollouts for refugees and migrants at both national and local levels. Here in this one is a study that examines how social networks impact in the quality of life for female long-term colorectal cancer survivors. The research found that strong social connections, including frequent interactions with family and friends, positively influence mental health and overall well-being, emphasizing the importance of support networks in survivors' care. In this one, for example, yeah, here so how interconnected system can inform and provide strategies in various fields. By examining networks, we gain value insight into patterns, interactions, and influence. These findings can be leveraged to optimize decision making, insight collaborations, and drive efficiently in addressing challenges across different domains. For example, this is very interesting. This study focuses on the challenges Latino immigrants face regarding social isolation and the barriers to building social networks in the United States. It highlights the negative health impact of perceiving social isolation and insufficient social support. Through interviews with 28 Latina immigrants who experienced trauma, the research identified key factors contributing to their isolation, such as family separation, cultural adjustments, and socioeconomic constraints. By understanding these challenges, the findings emphasize the need for intervention aimed to fostering social network to improve the mental health and the well-being for Latina immigrants. Let's go to specific studies of sexual networks. Here, for example, this study investigates the context of sexual risk behavior among men who have sex with men in Peru, focusing on the intersection of partner types, substance use, and location of sexual encounters. The findings reveal that condomless and anal intercourse is prevalent. The study highlights higher condomless intercourse where substance use also played a significant role. This insight aimed to inform target interventions to reduce sexual risk behavior in this vulnerable population. Here in this one, this study explored the relationship between virtual and physical space in facilitating HIV risk behaviors among the same population in East and Southeast Asia. Using data from a very big sample recruited online, the research reveals that those engaging with partners both online and offline exhibit the highest risk behaviors. These including having multiple male partners, engaging in unprotected intercourse, obviously, and consuming alcohol before sex. The findings emphasize that while the internet does not inherently increase the risk, it provides a significant opportunities to reach and support this population at high risk through tailored web-based and prevention intervention. So it's a very good point of this research. And the last one, that is a study conducted by my research team and me, we explored the structure of social network among this same population using dating and contact application and their relationships with risk sexual practice such as condomless and chemsex, that is the use of drugs during the sex, and obviously the group sex. Basic on descriptive cross-sectional, we involving 32 participants from Madrid, Spain, and we use social network analysis metric to analyze these interactions. The findings reveal that participants with higher socioeconomic status, for example, are more likely to engage in group sex and display stronger social connections, which correlate with higher rates of unprotected anal intercourse. This study highlights the potential of social network analysis to enhance public health intervention and inform nursing practice in promoting safer sexual behavior within this community. Thank you very much for your attention through these presentations. I would like to sincerely thank the organization once again for the opportunity to share my research. And I apologize if the time has been a bit limited today, but I'm more than happy to answer any questions you might have now or by the email. You can see the email. Thank you very much.
Hi again, everyone, and I hope that you're freshen up in these few minutes. So, we're going to an interesting speech from Ms. Nusha Poursada that I'm going to introduce you once more, who is a Master of Science in Nursing Management at University of Medical Sciences, Iran, and also from Ms. Bahar Hassan Tabar, who is also our International Coordinator and Master of Science in Midwifery, Tehran University of Medical Sciences, and Master of International Health Candidate, Diploma in Public Health, Charité Medical University from Germany. And the interesting topic is leveraging art to raise awareness of planting health, yes? Planetary health, evolve emotional responses, and inspire action. A case study of nursing and midwifery. Sorry for mispronunciation. The floor is all yours.
Hello again, everyone, and I'll be presenting the second part of my presentation in the role of art in planetary health. Okay. I did this study together with one of the best colleagues and dear old friend, Bahar Hassan Tabar, and in Tehran University of Medical Science at School of Nursing and Midwifery. And I want to appreciate Bahar because she bring this critical issue to my country, to my school, and she traveled to my country from Germany and bring this critical issue and topic to my culture because of convey a message to country with love and responsibility to planet. The topic of the study is leveraging art to raise awareness of planetary health, evoke emotional responses, and inspire action, a case study of nursing and midwifery students. As you know, planetary health is a critical issue, require innovative and creative approach to educate and advocacy. Art, with its capacity to evoke strong emotion, is valuable tool for raising awareness about planetary health. This study explores how art can be effectively utilized to this. The aim of this study is to raise awareness about planetary health among students in nursing and midwifery students, and the second is foster emotional connection between this topic and students and inspire action about this. The methodology of the project was divided to 2K stage. The first stage called for submission. This poster is in Persian language, and we invited the students to talk about the planetary health through the artwork. To encourage student participation, excuse me. To encourage student participation, we invited students to express their thoughts and emotions about planetary health in with artistic creation. To call for submission aimed to inspire creative reflection of this critical topic. To motivate students, we shared example of impactful artwork related to planetary health from global sources. And the advertisement campaign was conducted through multiple university communication channels, including social media platform like Instagram or Telegram, and a student email list and a smaller digital group to maximize outreach and engagement. The second stage, reflection and goal setting. After receiving the submitted artwork, we ask a student to reflect the creative process and its emotional impacts during the time that they create the artwork and the process. Participants were invited to complete online form where they describe the emotion they experience while creating their art. Additionally, we invited them to complete an online form and at the short um, uh, um, excuse me, short-term and long-term goal to help and contribute to planetary health. And for ethical consideration, the form did not include any question that could identify a participant, ensuring anonymity and creating safe space for honest reflection. About the finding, this case study highlights how art effectively raise awareness and inspire nursing and midwifery students to engage with planetary health through emotional reflection. And it's important about emotional reflection. Of 25 submitted paintings, 1,600% were from nursing students and other one from midwifery students, with dominant emotion being of concern and hope. While students were informed about environmental issues, they struggled with understanding the scope of planetary health and translating emotion into meaningful action. Participants recognized the critical role of nursing and midwifery profession in planetary health, focusing on medical wastage management and green hospitals. Students expressed short-term goals like campus campaign and collaboration, and with long-term aims to educate future generation and influence policies to extend the planetary health impact. Now, here, for example, we share of painting and the feeling of students around the time of during the paint. And I invited Bahar to continue.
Thank you very much. So, as my colleague Mirsha Saadat explained, this study was conducted in two parts. The first part was a call for submitting some artworks, and the second part was we asked students to have some reflections and have some goal settings in short term and long term. And now we can see their paintings. We selected some of these paintings to highlight the students' message, and also it was interesting to include these paintings in this folder for other people to also get some inspirations. One of the students commented that while I was painting, I thought about how bringing life back to empty, barren lands happens because of people who truly care about the health. Their efforts create positive change, like ripples spreading across water. This may not seem directly connected to midwifery or nursing, but it's still about caring for life. We need to work hard now to protect the airs for future generations. Let's move on to the next painting. As you can see, it's really such a beautiful painting, and one of the students said, at first, when I heard the term planetary health, it didn't mean much to me. It was just another phrase, something abstract that I couldn't really connect to. But as I started gathering my thoughts for the painting and searching for inspiration, something clicked. I realized how much I missed the clean air in Tehran, something I used to take for granted. It hit me hard to think about how polluted the city has become and how we've reached this point. It made me sad, but it also sparked something in me. I wanted to do something about it, even if I'm not exactly sure what that is yet and what I can do. So, what was very sparking for me is that the students kind of eventually associated with planetary health concept. But what was missing is that what can we do now? What are some actionable strategies? How can we get involved? Next slide, please. Another student commented, I honestly didn't have a clear plan in mind when I started this painting. I let it flow freely. I began with a green leaf because I love nature, but as I painted, I added humans desperate for greeny and fresh air. Then I thought about greenhouse gases and how companies carelessly pollute our air. I want to connect with others who care about this issue and share the same concerns. But sometimes it feels like people don't take this seriously enough. So, as you can see, students have the hope to connect and do some initiative work, but they do not know who to connect with and how to start acting. Next slide, please. So our discussion and this study demonstrated that art can effectively foster emotional engagement and reflection on planetary health among nursing and midwifery students, aligning with previous research showing that creative approaches enhance environmental awareness. The emotional responses, hope, concern, frustration, identified in this study echo findings by Lin et al., who emphasized that emotional connection is a critical precursor to environmental action. However, as observed in other studies, the challenges lies in environmental action. However, as observed in other studies, the challenge lies in actions, highlighting the need for structural guidance and actionable frameworks. Integrating art-based education with sustainability-focused curricula could bridge this gap, empowering healthcare students to act as an environmental advocate. So in our conclusion, this case study demonstrated the power of art to raise awareness, evoke emotions, and inspire actually students to engage with planetary health. While students reflected deeply on the environmental roles, a gap remains in translating this awareness into actions. A structural educational framework and collaborative initiative can empower students to drive sustainable healthcare practices and advocate for planetary health at clinical, community, and policy levels. So we hope that this study would embark some interest and we would design some actionable initiatives also at the level of our faculty at our University of Medical Science. Thank you.
So thanks a lot for your presentation. We really liked them, especially the paintings. They were really nice and creative. And also what you did was really initiative. So I think that you pioneered it in Tehran University of Medical Sciences. So I should express my gratitude. So we're going to the next speaker. I'm going to invite Dr. Zabina Balnach, who is Master of Science in International Health, independent consultant, lecturer, and she's in the department, and she's also a planetary health researcher in Germany. Her topic would be climate changes and women's health. So that would be great to have you with us, and I hope that you're doing well right now. Over to you.
Thank you so much. Thanks for the introduction and most of all for the invitation and the opportunity to speak. I think this is a fantastic initiative that I truly appreciate by the university. it's a move into the right direction, I believe, on a critical, important topic. So thanks for that. I will try and share my screen and share my slides. And if you could just give me a feedback if you're able to see it also in the presentation mode.
Of course, sure. Now we're having your slides, and if there was any technical problem, I would interrupt you. Don't worry.
Excellent. Thank you so much. So I want to take the next 30 minutes to talk about the threat, the climate-related threats to maternal and child health. And I believe on day one and the previous speakers, you already learned a lot on planetary health, the linkages between climate change, the climate crisis, and health in general, the planetary boundaries. And now we want to dive a bit deeper into the medical aspects and how the climate crisis is affecting women, in particular around this very vulnerable phase of pregnancy, childbirth, and also the neonatal health. So before we go into that, I would like to contextualize a little bit to explore what kind of challenges we are seeing in Iran, but also what kind of opportunities are arising. And I think this is always a very important perspective to take instead of just looking at the negative consequences, also to highlight and illustrate a pathway into the future to deal with all these challenges. So what I brought you here on the slide is first of all the temperature evolution of Iran, and you see that temperature increase is quite an issue in the country, especially over the last years. This is the evolution over the last 100+ years, and particularly in the last 20, 30 years, we see that the trend is really going steeply up. Iran itself is contributing by 1.8% to the global greenhouse gas emissions. It ranks 8th position worldwide among the emitting countries and ranks first in the MENA region itself. On the other hand, as I just said, in the country we already can observe the implications. Iran is holding maybe a little bit sad record and one of the hottest temperatures recorded in Asia. It is suffering from extreme weather events like floods, storms, droughts, wildfires, and also, as we also just heard previously, reduction of poor air quality. At the same time, the country is in a very vulnerable position, and this is due to the geographic factors, environmental implication, economical, but also climate characteristics of the country. And we're going to slowly unpack that a little bit further. First of all, I know I forgot that slide. This is from the WHO. The office in Iran, the Health and Climate Change Country Profile that was published 2 years ago, that is illustrating climate-related implications to health and also giving some projections. So that was a interesting read. I've never been to Iran. I'm still hoping to be able to visit that beautiful country, but this was very informative for me also in preparation of this presentation today. The results that we are seeing in the climate-related implications, as I just said, are mostly the rising temperatures, extreme weather events, and also the poor air quality. Some of the projections that the country profile reveals is that there is an increase of 2.6 degrees Celsius expected, and 35% decline in rainfall patterns in the next decades. So it will be very hot and very dry. And obviously, this is also showing impacts on health. If you look at heat waves, these extreme weather events that I was just mentioning, but also health threats related to food, water, vector-borne disease, and also mental health consequences natural disasters, and other climatological hazards. I don't want to go into the details of that. Maybe you also heard that beforehand. I want to start to unpack a little bit why climate-related factors are particularly dangerous for women and girls, particularly in this very vulnerable phase around pregnancy and childbirth. And I want to introduce, maybe some of you know it already, the concept of determinants of health. And you see here, it's really just meant as an illustration how the individual health of a person is influenced by various sectors. So you can see that, let me just get my pointer. So you see this individual person is obviously, the health status is obviously influenced by age, but also the sex, the genetical heritage, but also many other factors around, like the level of education, the socio-economical opportunities, the environmental conditions around them. Does a person live in a city or in a rural space? What kind of infrastructure is available, healthcare services, and so on, and so on, and so on. So a lot of factors influencing individual health. And as you can tell, I'm slowly leading over to the gender-specific determinants of health. The WHO has classified these these various factors of health determinants in 3 categories. So there's a social and economical environment, as I just said, your educational level, the socioeconomical opportunities that a person enjoys, the physical environment, what kind of environmental hazards am I confronted with, maybe rising sea levels or storms or droughts or air pollution, or that has an impact on my health status, but also individual characteristics and behaviors. Who am I? Am I a man or a woman? Do I exercise and practice sports, or what other kind of health relevant behavior do I show? The gender and the sex interact as modifiers of major causes of death and morbidity. So the biological sex, on the one hand, are the physiological responses and the biological preconditions that a woman has. It also defines and determines the susceptibility, the vulnerability, and the disease progression. So to give you an example for how a woman responds to heat stress is very different to men, and that is a physiological matter, relying on her ability to cool the body and so on. So we're going to talk about this in a little while. So beside of the biological sex, we also have that societal gender dynamics, the roles and norms that are influenced in a very context-specific way, but influences the individual health of a woman. So kind of the material or structural factors like access to resources, access to information, healthcare, also the psychosocial factors or behavioral factors. Excuse me. This is a busy slide, but it kind of tries to bring it all together. It is not yet specific to climate change, but more on health threats that are defining particularly a woman's health. So on the top, you have what we just talked about, the gender and sociocultural factors, also the sex and the biological factors that are influencing each other. And these both affect exposure and vulnerability, and also intersecting with other social characteristics. So in the end, the question is, how much exposed am I to a hazard? For example, how much exposed am I to a heat wave or to high temperatures? How vulnerable am I? That is related to the susceptibility and also the adaptive capacity. How much am I able to deal with these health threats? And also the climate-related hazards. The probability of hazard occurrence, like, for example, a sandstorm or a drought or rising sea levels and so on. And this pretty much all interacts together, defining the health of a person, in particular a woman. If we translate this now to climate change, we see that the impact of climate change on pregnancy outcomes are also multifold. So on the first level, you see here environmental factors that influence pregnancy and the health status of the mother, as well as the unborn or the newborn. There are, for example, heat waves, wildfires, droughts, hurricanes, floods, as we already mentioned. There are also indirect impacts, air pollution, food scarcity, water availability, and also the quality of water, but also certain shifts in vectors, hosts, and pathogen distribution. And then also indirect impacts on maternal and neonatal health through the social environment. So food and water insecurity is one example, but what is also the social support network that a woman during pregnancy really relies on. And if that is impaired or disrupted, what is this doing to her health? Displacement is another example, and you could add on that. And then there's also on the individual level, the biological, physiological changes, for example, the inflammatory response to a pathogen like a vector-borne disease, or the endocrine disruption, malnutrition, infection, and also the psychological changes. On the other hand, we also have further influences by the health system. So how good is the health system? Do I have access? Is it available? Is it set up in a way that it's really meeting the sexual and reproductive health needs of the population? What is also the social and physical environmental context, and so on. And then this is all together influencing, as you see here on the bottom, it all comes together, resulting in adverse pregnancy outcomes. So what we see as one of the climate-related implications or health threats during pregnancy, we see gestational complications. We often see low birth weight, restricted fetal growth, preterm birth, stillbirth, spontaneous abortion, but also neonatal mortality. On some of my slides, you see the QR code, so you're welcome to check that out if you want to do additional reading on these publications. What I also find interesting is to look at the climate-related health implications along the life cycle of a woman. So if you look at an adult female, a woman who is not pregnant, but is obviously, depending on the determinants of health in her surrounding and from her individual preconditions, is obviously influenced also by these environmental and climate-related hazards. We can, for example, say environmental hazards like, again, heat waves, storms, and so on. We can also look at mental health complications, but also cardiovascular and other chronic disease, reproductive, endocrine, and metabolic complications. And again, you could extend on these lists. But a woman will have experienced health threats due to these climate-related exposures. So if she then gets pregnant, through the adaptation factors of a pregnancy and her in increased vulnerability due to this changed physiological condition she's in, she's again exposed to certain health hazards. And that continues for pregnancy. It also adds on the health threats of the offspring, of the fetal development. As you can see here, fetal distress, restricted fetal growth. We see preterm birth, birth defects, and so on. And obviously this has also, like starting for the offspring already in the womb, but then after birth continues, adds on and influences the implication continues throughout the lifespan of this new born person until it reaches adolescence, an adult age, and then becomes pregnant again. And you can see that throughout this lifespan, environmental and climate-related hazards will influence this woman's life. So we can conclude with the WHO that climate change poses an existential threat to all of us, but women are disproportionately affected by these consequences of climate change and the related health hazards. We see that pregnant women and babies and children face some of the gravest consequences of war. And climate change is an urgent threat to pregnant women and children. All statements by the WHO. So what I've done now in the coming slides, that I've taken some of the climate-related threats that are listed in the Iranian country profile. So this is all from the country profile that I showed you in the beginning. And afterwards, I'm showing you how this is impacting the sexual reproductive health of women and also the babies. So we have 3 examples. We start with extreme heat, because that is quite a challenge or a health threat in Iran. The population exposure to heat stress is likely to rise in the future. It is already a problem, but the projection include that this will increase in the future. Will be further challenged by the increasing urbanization. And I don't know if you heard about this urban heat island effect, where you really have a particular heat accumulation and very hot temperatures in urban spaces. And that we will see an increase in the likelihood of severe heat waves. So by the end of the century, it is expected that there will be an above 5 degrees Celsius annual temperature rise, resulting in about 65% of days that are hot. So the question is, this will obviously have an effect on the entire population, but based on what I said before, what is this doing with the health of pregnant women and newborns in Iran? So those are the threats that we are seeing there. So if we are looking at the particular threats to health, we know that with the increasing climate change, we see an increase in the frequency of extreme heat events, but also rising average temperatures. So for the women, it means that we see disproportionate heat-related morbidity and mortality. And that is related to the fact that women have a higher working metabolic rate, a reduced heat dissipation through sweating, and decreased effective radiative cooling. So her ability to adapt to rising temperatures is lower compared to a man. In the time of pregnancy, we see adverse reproductive outcomes, such as preterm delivery, congenital defects, gestational hypertension, and you can know this can easily shift into life-threatening conditions like preeclampsia or eclampsia, and become quite an issue. The underlying physiological vulnerabilities are that heat increases the production of vasoactive substances, we have an increased blood viscosity, and it also affects the endothelial cell function, so resulting in an altered placental blood flow, resulting again in that hypertensive crisis with the potential complications for the mother, but also the baby in form of hypertensive disorders on the maternal side, but also stillbirth on the fetal side. Also, hyperthermia is teratogenic, and yeah, we leave it to that. Beside of these physiological and biological vulnerabilities, we also have this gender or societal aspect that differs obviously from country to country and might be very context specific, also in regards to the location within the country. Are you a person or a woman that lives in the countryside or in an urban space? And how much are you influenced by these cultural norms and your individual societal role that you're playing? So that will define how much access you have to healthcare, cooling facilities, but also access to communication and information. In many places, we also lack that gender disaggregated data. So often we don't really know what the underlying problems are because it is not, there's no data collected on that. And other aspects like culturally prescribed heavy clothing. And again, these are just a few examples and they might vary, but you can see how gender-specific norms are further adding on a woman's ability, particularly during pregnancy, to deal with heat. It is again an overview how heat and pregnancy interrelates, just broken down a little bit further. So we, on the women's side, on the maternal side, we will see this hypertensive disorders that I already mentioned, gestational diabetes. On the fetal side, we will see stillbirth, preterm birth, but also congenital abnormalities. For newborns, we have to expect low birth weight, hospital admissions, bleeding, but also suboptimal feeding practices. So you can see that during these hot days, the health burden on the affected population is increasing, but also the related burden on the health system and health professionals like you as nurses and midwives will particularly increase. Yeah, down here you have the exposure pathways and just a little bit more explanation why this is happening, like heat stress is leading to dehydration, compromised placental development. Obviously, that is then having an effect on the development of the fetus, how well or not well it is able to develop in the uterus and so on. And just a few additional examples. I think we don't have to go through it in detail, but just to give you an idea how complex and interrelated it is. The next example is air quality. And again, I've extracted that from from Iran's country profile on climate change and health. And there, in regards to air quality, we see that recent data indicates that in the top 10 most populated Iranian cities, air quality is far above the WHO guidelines, and with related effects, obviously, on the population. And you see here these 10 cities that have participated in that study. So in these cities, women will be suffering from this air quality. Before we heard how emotionally challenging it might be to see this disruption or destruction of our natural environment and the natural world around us. But also there are these health consequences. This poor Air quality mainly comes from the burning of fossil fuels, transportation, and so on, but also from increased ground level of ozone from elevated temperatures. The same like the previous table, for all women, we see respiratory and cardiovascular disease. You might think that, yeah, but men would be affected as well. Yes, definitely. But again, women on a disproportionate level, because women experience a greater disposition of inhaled particles in their lungs. So that is sex-specific. And secondary to higher prevalence of anemia, for example, women are more sensitive to toxicological exposure. During time of pregnancy, also we see adverse reproductive outcomes like stillbirth, intrauterine growth restriction, and also congenital defects. We know by now that air pollutants and fine particles can cross the placenta and impair fetal growth, but also these fine particles are starting to accumulate in the fetal organs, resulting obviously in impacts. Yeah, and then beside obviously maternal air pollutants obviously impair maternal and respiratory cardiovascular health, resulting in a reduced efficiency of the placental function with the negative consequences obviously for the baby. On the gender or cultural and socioeconomical side, we often see traditional habits like indoor stove cooking that pose a particular health hazard to women who are mainly, often mainly at home, depending on the context, obviously, again. But that is one of the gender-related hazards that we are experiencing and others. So again, these are just examples and the list can be prolonged. Last example, extreme weather events. So in Iran, we see on the one hand an increase in exposure to riverine, but also coastal flooding due to rising sea levels, and the riverine flooding obviously to increased rainfalls and others. This is expected to rise dramatically in the future, with the country profile projecting that there will be above 6 million people in rural areas affected and almost 12 million people in urban contexts affected by flooding events. Again, the question, what is this doing to maternal and child health? We know that under the climate crisis, we see an increase in the frequency, in the occurrence and the frequency, but also in the severity of these disasters. This is including hurricanes, flooding, wildfires, but also sandstorms, which I think is quite relevant for the Iranian context. What we know of these extreme weather events, that women are suffering disproportionate mortality during natural disasters. It is also observed that they have a decreased life expectancy. They are experiencing higher risk of physical and sexual violence, especially for women living in of lower socioeconomic status or marginalized groups. Mental health is also an issue, and women giving birth in the time period following disaster have an increased risk of complications that are including, for example, preeclampsia, bleeding, but also low birth weight infants and so on. Yeah. The underlying causes, women of all ages are more likely to experience dietary deficiency, leading to poor physical health and vulnerability to resource shortages ensuing from catastrophes. And then poor baseline nutritional status and physical health may also prevent escape and survival in the acute phase and also in the aftermath of disasters. You see that for extreme weather events or natural disasters, the cultural and socioeconomic factors are very important as well. The underlying reasons are that women often has unequal access to basic social goods, and mortality is worsened when women have a lower socioeconomic status. But also, due to their role in society, being often the caretaker, they are often at home, maybe missing on information, or also the one who have to deal with the higher care burden, and so on. I'm not going to go through the whole list, but you can see and maybe also read yourself how things are interrelated here. Yeah, that's a study that I find quite impressive. It's from the aftermath of Hurricane Harvey in the US, and they examined around 30,000 pregnant women giving birth, almost 4,000, 3,800 giving birth within 40 weeks after the hurricane, and it was observed that there was a 27% higher maternal morbidity and 50% higher neonatal morbidity in the aftermath of that hurricane. And again, what we already mentioned, women of low socioeconomic status were most affected. So you can see how there's a really strong linkage between that, and the implications are huge and also utmost relevant to decision makers, health professionals, in the healthcare sector as such. Specific also to natural disasters is that we often see the health system is affected as well. So we see acute, intermediate, and also long-term effects. If you think of the different climate-related threats, if you think of a heat wave or natural disasters, obviously this will have an acute effect with a steep increase in caseloads, intermediately, but also long-term as well. If you think of certain infectious, maybe vector-borne diseases that are being observed in certain health facilities that were previously not exposed. So we can say that all of the WHO health building blocks, and I put a little graphic here as well, that all of these building blocks are affected. And I often, or I like to do that with my students as a group work or as an exercise, to take a climate-related health hazard and let them explore themselves how this is affecting a certain health system block, like, for example, the workforce. If you think of heat waves, what is this doing with health professionals, or what are the challenges that we are seeing in the health information system? And then also, on the other hand, what kind of activities and interventions can be implemented to deal with these challenges? So sort of a climate vulnerability assessment, and then based on that, an adaptation strategy that you can build on that. For maternal health, this means that if we have these climate-related threats to the health system, we see often a disruption in these services. Often maternal and newborn or sexual reproductive health services tend to be deprioritized or overlooked in any crisis, and obviously this is the case in the climate crisis as well. What it comes down to, that women might not have access to regular antenatal or postnatal care, maybe their usual contraceptive supply is missing. They don't have the, access to emergency obstetric and neonatal care. And then obviously this is resulting in adverse health outcome like unwanted pregnancies, maybe unsafe abortion practices, but also maternal complications and so on. One thing that I want to highlight is that we've only been talking, or I've only been talking about climate change. I think yesterday you already heard about the planetary boundaries, I think by Oscar. And what we need to keep in mind that the climate-related implications to health are only one aspect. That with the transgression of the other boundaries, we have further potentially accumulating health threats, particularly for this very vulnerable group of women and girls. So just to give you one example, novel entities. So there has been a study already a few years back now that the microplastic has been found in human placenta. But there are by now more and more studies coming up. What the interrelations or the linkages between the transgression of the planetary boundaries and health, and particularly maternal and newborn health are. So keep that in mind. It's not only about climate change, it's also about other environmental implications to health. So I'm almost done. Let me just quickly check the time. Sorry for that I'm taking a little bit longer. But what I always think is the most important thing is the way forward. So lots of challenges. What can we do? The WHO has last year announced a call for action. So they've been trying to raise awareness about the impact of climate change on maternal and newborn and child health, demanding action to address these challenges. And if you want to read more about it, here's a QR code. What needs to happen, obviously, is on the one hand, that we need to mitigate, we need to bring down emissions. And in the very beginning, on my first slide, we have seen that Iran is among, same as my country, by the way, I'm based in Berlin, in Germany, that these are big emitting greenhouse gas emitting countries, and mitigating is obviously one of the most important pillars. And I brought you this slide to think of the health co-benefits. And I'm not sure if this was in one of the previous presentations or not, but these are interventions that have benefits for both the health of the planet and also the health of humans. So if you think, for example, about active transportation or shifting to a plant-based diet, this has a mitigative implications to climate change because we are reducing greenhouse gas emissions. And on the other hand, it is shown that this goes hand in hand with many advantages for our health. So if you shift from a car to maybe walking or cycling, this will bring down obesity, reduce cardiovascular and other diseases, and so on. And what I really like is that there has been a publication how this might change also maternal and neonatal health. So if we really follow this Paris Agreement of bringing down our greenhouse gas emissions and reducing global warming to 1.5 degrees Celsius, what are the health benefits to that? Often it is said that the Paris Agreement is the strongest health policy that we have. And in the study that I brought you here, they looked at reducing air pollution levels in net zero scenarios in 16 cities from around the world. And in the graphs, you can see the cities listed. There's, for example, Lahore, Manila, Mexico City, Nairobi. I think there's also London, Glasgow, Freetown. You can read through it yourself. And they have observed that with the reduction of particular matter, so reduction of fine particles in the air and improvement of air quality, that there was an improvement in some health indicators. So there were more than 20,000 cases of childhood asthma prevented per year, and over 43,000 premature births per year prevented, or 22,000 low birth weight births prevented. So you can see by just mitigating emissions, what a positive health impact we can induce and do actually something good for the planet, but also for ourselves. So that is a mitigative element. And then on the adaptation side, I took a graphic from Women Deliver. It was a report that they released a few years back, in 2021. Climate change, adaptation, and maternal and newborn health. And they kind of came up with 8 interventions. So there is the evidence side, and we need to strengthen the evidence base on the linkages between climate change and health. We also use gender analysis to inform the adaptation process, the adaptation planning, to meet those needs of women, particularly during time of pregnancy and the newborn or the perinatal period. So that is a second recommendation. Collaboration. Often it is said that in planetary health, we need to work transdisciplinary. And I think for women's health, as it is so much influenced by gender dynamics, and also the fact that many of the health influencing factors actually lie outside the health system. If you think, for example, on traffic, like air pollution is affecting so much our health, but how can we work together across these sectors, like health and the transportation sector and gender and other factors, maybe education itself, to really find solution or more comprehensive solutions to tackle these complex challenges. A resilient health system is obviously important in general. A holistic approach that emphasizes really the resilience of the health system can address climate risks, while it also addresses other health concerns, so including sexual reproductive health. I think you already had a session on climate-sensitive health counseling, or also carbon reduction in the healthcare system. Those are kind of the interventions that we need to implement to build climate resilient and low carbon health system. And I think moving forward, that is utmost important. Disaster risk management. This also needs to be addressed as well, like addressing SIHR and mechanisms to prepare for, respond, and recover from climate-related disasters. Then financing needs to consider these aspects as well. Monitoring and evaluation, I think I mentioned it a little bit earlier, that we need to adapt our health information system to also collect data on these interrelations and use them for our adaptation processes or planning, but also for health planning in general. And then obviously policy alignment. Align adaptation planning processes with other gender and health related policies. I think I leave it to this. What I want to close on is, as health professionals, and that's what I illustrated here, there are huge challenges ahead of us. And for those of us working in the field of maternal and neonatal health, we see that the challenges are disproportionate. And the question that I want you to take home is, how can you as an individual make a difference and induce change to tackle these huge challenges that we are facing? This is an invite from the WHO. Every action will count. Pledge your commitment to protect maternal and neonatal child health needs from the impact of climate change. So you can click on the QR code and sign up and share how you're contributing. But in the end, I think it's really important that we all start to make a difference and start acting upon these challenges. And I leave it to that. Thank you very much.
Thank you very much, Dr. Baunach. That was a great speech. I actually took notes from the beginning to the end, and how you talked about individual health risks, that these problems, in my view, can of course lead to public health problems because of some indicators like neonatal mortality rates per 1,000 cases. And this can also lead to losing the young workforce and leaning on the foreign health workers or foreign workers that Germany faced in the 60s with 1 million foreign workers that majorly came from Turkey. And I hope that we can use your experiences as a country who face these problems to solve our own problems with a deteriorating population and losing our young workforce. So, danke schön, auf Wiedersehen.
Thanks for having me.
Dear Dr. Sabine, thank you very much for your contribution to this conference. It's a great pleasure and honor for us to have you with us in this conference. And also, I want to add something. Actually, Bahar have talked about you a lot with me, and I know that how distinguished you are and how inspirational you are for her. Actually, she is impacted by you in terms of her personal and professional life. And I want to say congratulations to you because you are a very effective incentive for her to make her to whom she is now, and you actually steer her towards her valuable goals to be able to make a big difference in nursing and midwifery education on planetary health. Thank you very much. And also, I hope that this conference would be an initiative for our future collaboration, and we will be able to find common grounds, and we will be able to develop a new horizon for our fruitful collaboration. Thank you.
Thank you very much. Thanks.
Hello.
So, thanks a lot, dear Zabina, on my behalf. That was great. There's no word to say. So we're going to our last speaker, Dr. Salume Bukachi. She's professor in Institute of Anthropology, Gender and African Studies, University of Nairobi, Kenya. It's great to have you, and your topic, the topic you're going to discuss is gender and cultural aspects in addressing infectious diseases from a health perspective. So that would be great if you could share your screen and camera with us.
Hello, everyone. I'm so sorry that my video is not working, but I'll just proceed. At least you can see my slides.
Yes, clearly.
Thank you. Yeah, so thank you so much for inviting me to be part of this conference, and I'm very grateful to be able to present my work. I'm Salome Bukachi, a professor of anthropology in the Institute of Anthropology, Gender and African Studies, University of Nairobi, Kenya. And I'll just be taking us through gender and cultural aspects in addressing infectious diseases from a One Health perspective. So when we look at gender, maybe it's just first good to look at the gender agenda. And one of the things I would like to say is that including a gender agenda in One Health provides us with tools with which we can enhance the effectiveness of disease prevention, preparedness, and response programs, and helps us to work towards equity inequality of opportunities to attain optimal health. So this then helps us to highlight the impact of gender on exposure to disease, experience of disease, management, and prevention of infectious diseases, and provides a pathway to inclusive socioeconomic growth as a key component of the Sustainable Development Goals. So when we look at gender considerations, a question we ask ourselves is, how can we harness our knowledge, our understanding, and the experiences of the people, experiences of pathogens, animals, ecosystems, health innovations, and technologies to improve the human, animal, environmental well-being, as well as bring about socioeconomic and cultural transformation? How do we, as we are dealing with aspects of health, as we are managing health in the community, how do we harness that knowledge and the understanding of the people we serve, be able to bring socioeconomic and cultural transformation? And then also, how do we move health interventions from being gender blind, where we're not taking into consideration gender, to being accommodative, with the eventuality of having transformative programs? So those are key questions that are important to have at the back of our minds, even as we engage in dealing with health issues. So I will give an example of a case study of work that I have been doing, looking at gender, culture, and One Health. I've been working a lot on human African trypanosomiasis, or sleeping sickness. And this is a disease that is transmitted by the tsetse fly. It impacts mostly communities in rural areas. It presents as malaria, fever, joint pain, and so sometimes it's confused with other diseases. But eventually, if it's not treated, it can lead to death. And so I'll use a case study of that disease to help us just see how we can incorporate gender in what we are doing. So I'll start by looking at the aspects of diagnosis, because this is a disease that sometimes, to be able to know whether you're suffering from the disease, you can't tell. You'll just have symptoms that resemble malaria, but it's important that the disease has to be diagnosed. And so one of the things we ask ourselves is, what are the gender considerations when it comes to diagnosis of disease? So for example, within households, there are social responsibilities of women that may hinder women from going to hospitals in the early stages of the diseases. Sometimes we see that when maybe people are called to go for checkups, sometimes we don't see the women coming because there are some things that may hinder them from going, their household and social responsibilities. A woman may ask, who will I live with the children? Who will take care of the home when I go to the health facility? And that may end up making her delay going for diagnosis. When we look at the aspects of men in our communities, especially our cultural setups, there's this aspect of men are meant to be strong, they are meant to be macho. And so there's that general tendency among men to endure illness until it's quite severe before seeking treatment. In diagnosis for this disease, we also saw aspects of stigma. For example, some of the men felt like if they are tested, their male organ will die. That's a perception in the community that for a man, when you're tested for the disease and you become positive, because I think the parasites have an effect on the man's libido and manhood. And so the men would fear going for testing because of this perception that is in the community that you'll not be able to perform sexually as a man. And because of that stigma, then people would fear going for diagnosis for this disease. This is a disease that occurs in different stages. And in the second stage of the disease, one is required to go through what is called a lumbar puncture. be able to determine whether the parasites have already gone, crossed the central nervous system into the blood, through the blood brain, have gotten into the blood, the brain. And this is usually, given that you work in the health sector, you know how this, what it entails to do a lumbar puncture. And so because of this, women would complain that after going through this lumbar puncture, they would have back problems that would hinder them from effectively undertaking their social roles. And as a result, because these again are women in the rural areas who have to engage in various activities, fetching water, firewood, cooking, it requires a lot of bending, digging, and all that. So because of this was one also of the things that also when we look at gender aspects is how does our diagnostic strategies impact on different gender, and how would that influence them adopting or accepting some of these strategies? When it comes to treatment, again, some things that we see in relation to gender considerations is that for this sleeping sickness or human trypanosomiasis to be treated, it requires long duration of hospitalization. And as a result of this, we find that this affects households because mostly when one is hospitalized, it's the women who are the caregivers. And because of this, sometimes either if it's the mother has to go take care of the father in the hospital or another child in the hospital, the girls in the home are now take up the role of their mothers. And so we find this aspect of reversal of roles where girls are also taking care of family, hence sometimes their education is also impacted on. So when it also comes to the follow-up, because with this disease, after you have been treated, you're required to come back for follow-up at least 3 times before you can be declared completely healed. We found some gender considerations when it came to compliance with treatment. For example, there are perceptions in our communities about who needs treatment. In many of our communities, it's only a sick person with visible symptoms that requires to go for treatment. So when somebody does not see any symptoms, they may think they're okay and may skip going for follow-ups. And of course, this also interacts with aspects of taking of drugs. In situations where we have diseases that require somebody to take drugs, the medicine for a duration, when somebody feels okay, they may end up stopping taking the medication, yet we know that compliance to the full treatment regime is very important. Another aspect is about acceptability, and this are related a lot to the social aspects. Sometimes the unpleasant side effects and experiences of different treatment strategies or different diagnostic strategies may cause people to shun going for treatment and follow-ups. So these are just things that we need to have at the back of our minds as we interact with communities, that the experiences, if they are unpleasant, may influence their compliance to treatment and may also influence compliance of other people to following up on these treatment regimes. There's also the aspect of affordability, cost of treatment, and in presenting to health services. When we look at the gender aspects, women normally lack finances and have to rely on their husbands to provide money and also to make decisions for them to where to go for health, to seek health. As a result of this, sometimes you'll find people seeking treatment from traditional healers. Maybe the woman, if she doesn't have money, she may end up looking for either traditional healers or traditional ways of treating diseases, sometimes may not be aligned to the public health measures. The long duration of hospitalization also affects men and women differently. You find that they will miss out on social life. And this may also affect the household, especially if the man the main breadwinner is hospitalized for a long time, this may have an impact on the family. And also, again, if the woman is also sick for a long time, it may impact the family and cause the girl child to step into the motherly roles, and that then may also impact her socioeconomic, her future socioeconomic life. So because sleeping sickness involves animals also, because it's a disease that can be transmitted, it's transmitted through the tsetse fly, but it also affects animals. And when animals are affected, humans can also get infected. So one of the ways of controlling the disease is also controlling and managing the disease in livestock. And so part of the strategies for control include vector control. And the vector control requires use of traps and targets. Also livestock baits. These are oil that is poured on the animal so that the fly does not land on the animal. And it also requires treatment of livestock. Again, when we go back to the gender aspects, where we find that gender entails the aspects of the roles and responsibilities, the decision-making, the ownership, the benefit from the livestock. In our communities, again, women don't own large livestock. They may own maybe chicken or goats. But when it comes to the large stock like cattle, they don't own them. They're mainly owned by men. And so the decisions around those livestock is related to men. So a woman may not be able to engage in these community vector controls if she has not gotten permission from her husband, because husband would be the main decision maker in terms of how they treat their animals, what they do with their animals. And so this may also contribute towards whether that household engages in control or not. The aspects of information dissemination and feedback or training, we find that many times when people are called for trainings, mainly it's the household head. And so the men are the ones who would usually go to these meetings. And once they get that information, sometimes it doesn't trickle down to the women. And so you'll find that sometimes women miss out on information because the person who called for the meeting just called the household head. Yet we know that in households, in agricultural households, both men and women are engaged in aspects of taking care of animals for the case of sleeping sickness. And so it's important that they're able to get information that may be useful to them. When it comes to information about how to treat, how to identify the disease, the symptoms, if the women are not part of these public meetings, then they may miss out on information that may be useful for them to be able to identify if somebody in the household is suffering from these diseases. The second thing, again, when it comes to gender, is the timing of these feedbacks or trainings. They may happen at a time when women are mostly busy. So when you call a meeting, especially early in the morning, women are mainly taking care of the children, organizing the household and all that. So they may not be able to attend such kind of meetings because of their competing household chores. And so this is information that's important, that even when we are doing our screening activities in the community, what time are we calling for these meetings? Who are we talking to? How are we engaging? That we ensure that women are also part of these meetings so that then they're not left out when it comes to health information and health trainings. The other aspect about gender that I would like to talk about is also about the dissemination of information that happens in the health facilities. Mostly when we go to mostly in the health facilities, we'll find that it's mostly women and children who go for health, are mostly common in health facilities. And it's also during this time that there's the education that takes place in the health facilities. So one of a key component that we miss out is the men, because the men are not very much in the health facilities. They miss out on this health education that happens in the health facilities. For example, it can be about antenatal care, mothers are taught about how to take care of themselves during the pregnancy cycle, how to eat and all that. But if the men are not part of that training, the woman may go back home, and because she's asked to eat some particular kinds of food, who is the decision maker at home? It's the man. And so sometimes the woman may not comply with some of the teachings he has been taught, health facility, because she's not the decision maker in terms of what she can buy, foods that she can access. So again, important aspects to just take gender into consideration when we're looking at information dissemination. So some of the points to consider, even as we look at aspects of gender, is that socio-cultural and gender dynamics, they play a very critical role in increasing or reducing vulnerability to infectious diseases. For example, now the trypanosomiasis I'm talking about. And not just for trypanosomiasis, but also other infectious diseases. If we do not take into consideration these socio-cultural and gender dynamics, we may not be effective in our public health strategies. It's also important to recognize how socially differentiated individuals, households, and groups may face different levels and types of vulnerability. Hence, it's important that our responses are targeted to make them inclusive. Sometimes they're marginalized communities who may not be able to have access to the various interventions we have. How are we ensuring that our healthcare, our provision of services takes into consideration these marginalized communities who may not be easily reached or who may be left behind? So as health workers, it's important that we are conscious about the different groups and how our treatment, our care may impact on them differently. Hence, we find out ways of ensuring that they are reached with the health care. Another point for consideration is that it's important to identify the inequalities and vulnerable groups within affected communities, as well as sources of resilience on which formal responses can build. So as healthcare workers, it's important that we note that communities also have some knowledge. They have information that we can work together with them to be able to build their resilience and their response to health and disease. For example, when we want to undertake a strategy, an intervention in a community, rather than just going and telling the community that this is what you need to do, it's important that we interact with the community and have conversations with them, dialogues with them to help them understand that this is what we want to do. What do they think about our strategies? How best can we as health workers improve our access, our provision of services to them? What are the things as health workers we need to take into consideration as we deal with those communities? And it's important to know that communities are different. And so the socio-cultural and gender aspects in one community or in one village may be very different from another village or community. So it's important that we understand that. And as we deal with these communities, we take into consideration those differences. Then again, gender and socio-cultural aspects are important in assessing, monitoring, and addressing inequalities and vulnerabilities in the process of infectious disease elimination. If we are not monitoring, what kind of data are we collecting? Do we disaggregate our data by gender to be able to tell how the different genders are being impacted on by our strategies, by our care? It's important that that data is disaggregated to enable us have that, to enable us be able to monitor and to improve on our services. So just to conclude, I would like to say that interventions need to be appropriate taking into consideration the socioeconomic and cultural environment of the community, the gender differences that exist, hence the need of all different expertise and sectors in joining together for a healthy people, healthy animals, and healthy environment. And as health workers, it is important that we take into consideration the gender issues because they're very critical in terms of helping us to be effective, offer effective health and care for all the different groups we serve. And that brings me to the end of the presentation. Thank you.
Thanks a lot. We really benefited from your speech, especially when you added some points about your context. We really liked it. So if I want to recap what you already discussed about, you pointed a very important concept of One Health that was really novel and interesting. So you're going beyond planetary health. That's really interesting. Then you talked about gender dynamics and their role in seeking help while people are getting infected and so on. You went behind that. I mean, you went beyond. And there were some really practical points about taking these gender dynamics into practice and how to react as a nurse, as a midwife, and how should we communicate our patients while needing help because we should consider what they're thinking, what are the stigmas, and so on. So thanks a lot. I really appreciate your speech. I really liked it. I want to invite Dr. Manukian to have a recap of today for us. Thank you.
Dear Professor Salma Bukati, I also wanted to thank you for accepting our invitation. Thank you very much for your time. Okay, dear all, I hope you all are still fresh and have enjoyed and have benefited from our conference. It's been a pleasure being with all of you during all these 2 days. We actually addressed various aspects of planetary health as this topic is multifaceted concept, and we had the honor to have esteemed speakers from various disciplines around the world that each provided us with valuable, insightful, and practical information in a comprehensive way. My first and foremost thank goes to prestigious speakers for their valuable contribution to this conference. I'm extremely grateful to the Vice Chancellor of Tehran University of Medical Sciences, Directorate of International Relations. Actually, without the boundless and sincere support of this unit, and specifically a Praise to Raise team, we couldn't be able to conduct this program. Also, I'd like to thank the Directorate of Educational Affairs of International Campus. Special thanks to Community Health and Geriatric Departments of Nursing and Midwifery schools. Also, Midwifery and Reproductive Department, Nursing Management Department, that we had some scientific committee members and also speakers from all these departments. Our esteemed scientific committee, Dr. Nick Pema, Dr. Cheraghi, and Dr. Shahbazi. I really appreciate the support of the Dean of the school, Dr. Shahsavari, because of his support, sincere support. I have a very special thanks to Bahar Hassan Tabar and Niusha Pursaadat. We are thankful to Bahar for presenting this new topic
and conducting this event that hopefully will be the beginning of new horizons and new joint work with our international colleagues. Actually, both Bahar and Niusha are very competent and dedicated ones. And also thanks to Niusha, that she made a lot of efforts as national coordinator. I'd like to express my gratitude to all the participants for making this event a success. And my last but not the least thanks goes to my young friends who put a lot of effort and passion to shape this event. At this moment, I'd like to ask my young colleagues to turn on their camera, that you get familiar with those who worked behind the scene. Thank you very much. I think it's better to start from that side. Okay. Please, Miss Rashidi. Okay, and we have Bahar, that I'm sure you know her. Miss Belukat. Niusha. Niusha Pursawadat. And our technician, Miss Sadeghi. And Mr. Mojahedi. Also, we have Miss Pega Khalifezadeh with us, who is online, and I'd like to ask her to turn on her microphone.
Hi, do you have my voice?
Yes, dear, we have your voice. It's clear.
Thank you, Dr. Manukian, and thanks to all my friends in this conference. It was a really informative conference, and I learned a lot. I'm sorry I couldn't be there today, but I learned many things from you.
Thank you very much, dear. Thank you.
You're welcome.
So, thanks to all of the participants in this program. We have a poem in Persian which says, به پایان آمد این دفتر، حکایت همچنان باقی است. Which means this is just a story that ended, but the whole book or the story of our lives is still going on. And for sure, we'll meet each other again in the future programs, and for sure, we'll try to be pioneers in our own fields. As a nurse enthusiast, I love this program, and this was a great thing to experience in my personal view. And for sure, we can strive for more, always strive for more, because human beings will always progress in their lives, and without progress, we're not alive. I want to see this program, as Hans Kochler first said, the Austrian philosopher, in 1972, as a dialogue among nations, because this can help all of us to be a part of a bigger family and progress together. Thank you all. I just forgot to mention, please turn on your cameras for the last screenshot. And about the certifications, I should mention that certifications might take about a month to get ready. And after that, we'll send you the file for them. Thank you all. You know, why you come Everybody, thank you. Please, can you turn on your cameras, everyone? فارسی نمیفهمم. So no one's gonna be in the picture, dear participants. Thank you, Dr. Otieno. It's so everybody come here. حالا کی اسکرین شات میگه اکتیویت کنیم. Everybody, the cameras are active. You can turn it on. Thank you all, and goodbye. See you later.